Shoulder injuries are probably one of the most common injuries treated in physical therapy. Rotator cuff tears, labrum tears, tendinitis, bursitis, dislocations or separations, or even fractures. Most patients who come into physical therapy with non-traumatic shoulder problems have what we call impingement syndrome. Impingement syndrome is just stress on a tendon or soft tissue in the shoulder joint.
The cause of these microtraumatic injuries are muscle imbalances that occur within the joint that lead to abnormal movement and mechanics. That puts stress on specific tissues, and then the tissue breaks down.
They start to notice these problems because of pain, and then they start to wonder, why are these things occurring? I didn't do anything, I didn't fall, all of a sudden my shoulder just starts to hurt. Eventually, these impingement problems, if not treated, will lead to bigger problems like rotator cuff tears or labrum tears.
Physical therapy helps these injuries by evaluating the muscle imbalances on a person, looking at their flexibility, looking at their strength, looking at the movement within the joint.
So our evaluation will definitely consist of a postural assessment. The posture often will tell us a big part of the story of why you're getting your pain and limitations with movement. Usually the limitations that we find are joint stiffness, poor flexibility of muscles, or poor strength of certain muscles.
Common treatments that it will encompass is modalities to bring down pain and inflammation, exercises to improve mobility, flexibility, strength and endurance.
There's going to have to be some manual intervention that's going to take the stiffness out of those joints to improve the flexibility of those muscles.
Trigger point pressure into the muscles that are tight to help release the tension and the tightness. Actually, passive range of motion of moving the shoulder and stretching the shoulder into directions that are stiff, along with joint mobilizations, which is actual stretching of the joint and the capsule.
We always try to pair that with some form of corrective exercise. The corrections that we're making are addressing specific problems that we've been able to pinpoint through the evaluation. The shoulder gets a lot of the problems because it's a very mobile joint. We use our upper bodies a lot. We're doing a lot of things with our hands and arms. So if the body is not moving perfectly, it's only a matter of time before too much stress on that area is going to cause a problem. We're able to make some changes that will relieve stress off the tendon and allow the body to move the way it's supposed to move and really avoid some bigger problems that could occur in the future.